So happy Menstrual Hygiene Day to my panelists and to everybody watching us this morning. We are glad that you're all safe and you're able to join us. So why is this day important? This day was created to have a world where women and girls are empowered to manage their menstruation safely, hygienically, and in confidence and without shame. And with COVID-19, we have seen a lot of disruptions in the society that have exposed the vulnerabilities that women and girls go through. And this morning, to celebrate this day, we are taking time to just look at the different facets of these vulnerabilities that we are talking about and what can be done to ensure that all women and girls have access to menstrual hygiene. With me, I have 4 panelists. I have Farida Aliwa from Practical Action. She will talk to us about the challenges for women and girls in low-income communities. I also have Laura Wawuda, who's joining us all the way from Kilifi. Thank God to technology that we can be in different spaces, but still meet. She works for WIMA, Women Empowerment in Kilifi. And she'll be talking, she'll be giving a grassroots perspective from really on the ground in Kilifi. We have Dr. I should call you Dr. Ambassador, Josephine Giambo, who is representing the Rotary Club, but also Rotary International, and also talking to us about implications of COVID in the humanitarian response and action. And then we have Angelina Shikanda. She's from CREAW, Women's Rights Organization, and she's going to talk to us the intersection between GBV and menstrual hygiene. So welcome everybody, and thank you so much for joining us. Without wasting time, I'd like us to start with our first panelist, Farida Aliwa, from Practical Action, who is going to share with us the challenges for women and girls in low-income communities. Karibu, Farida.
Thank you, Florence, and good morning, everyone. It's a pleasure to be here and on such an occasion which a lot of people don't know exist, but we're happy to add to the awareness that menstrual hygiene actually has its day. Thank you for the introduction. I'm the Director of East Africa for Practical Action, human rights lawyer, disruptive for women and children. I think that's what I'm known for. But today representing the organization, just talking about some of our work and experience with girls and women in low-income communities in Kenya, and how COVID-19 has exacerbated some of the challenges that they're having. I do want to just confirm whether I should share my screen or the slides and presentation that I have will be put up by the team.
Rachel is going to upload the screen. Rachel, please. Thank you. In the interest of time, Farida, just share your screen if you can, your presentation.
Sure, absolutely.
Thank you.
Okay, I will also just drop that down so that everyone can see my screen. So thank you again. I'm excited to be able to go first, although this is a topic that is quite, could take up some time when we talk about the challenges for women and girls in low-income communities. Just before I start, let me talk about who we are as an organization. Practical Action has been around for over 50 years globally, and in Kenya, for around 30 years. And our vision is a simple one, where we want a world that works better for everyone, and we help people find solutions to some of the world's toughest problems made worse by catastrophic climate change and persistent gender inequality. This means that we are looking at what we would call some of the problems that keep people in poverty, such as climate change, but also limited access to energy, working on agricultural practices, and importantly, enhancing access to water, sanitation, and hygiene. Specifically, our work in WASH, as I can call it now, is in urban slums and low-income communities, where we have an ambition to make cities in poor countries cleaner, healthier places to live and work. Our approach is very much community-based and working on through our values of collaboration. We're working with communities, municipalities, and utility companies to deliver sustainable sanitation, water, and waste management services. We're improving hygiene practices and protecting the health, safety, and dignity of poorly paid waste workers as part of our work in urban slums and low-income communities. As you had said, Florence, COVID-19 has exacerbated some of the challenges that people and young women and girls are having at this time. And as an organization, we're extremely concerned about the effects of coronavirus on vulnerable communities with whom we work with. People living in poverty and those who are more vulnerable, including girls and women, are likely to bear the brunt of the impact of the coronavirus pandemic. We also know that movement restrictions and illness will deal a terrible blow to people who rely on what they earn each day to live and eat. Our goal as part of our response as an organization is to help the people that we work with prepare for, deal with, and then recover from the impacts of coronavirus. We are looking at 3 specific elements of this response, where our initial effort has been centered around limiting the spread, but we also need to keep essential services running to be able to deal with the pandemic and also support long-term recovery and delivery for the communities that we are working with. Specifically for today, I wanted to focus on some of the challenges that COVID-19 has exacerbated, as I said before, for girls and women, especially those in low-income communities. And as we look at the Menstrual Hygiene Day, focusing on menstruation, we all know that menstruation necessitates safe water and access to basic sanitation and hygiene. In conditions such as these brought about by COVID-19, the need to practice safe sanitation and hygiene can be a matter of life and death for women and girls. According to our colleagues at WaterAid, illnesses related to a lack of water, basic sanitation and hygiene are responsible for the death of almost 800,000 women around the world in a single year, making it the 5th biggest cause of death for women. And this is when we look at the situation of young girls and women in especially low income and crowded settlements, we know that access to water and toilets remains a bigger challenge, especially where we have the use of shared facilities or where we have the lack of proper disposal options for menstrual products. And this is where we need to understand that access to water and basic sanitation is a right. And linked to menstrual hygiene, the critical elements that we would need to promote to be able to ensure that women and young girls have their right to better health and menstruation menstruation hygiene. We also know that in the situation that we're in, schools, communities, centers, and other places where women and girls would typically access critical information about menstruation are closed. Routine health services have also been reduced, exposing young girls and women to harmful practice and exploitation. Women and girls also have less access to digital platforms, and with the limitations that we're currently having with COVID-19, a lot of the information is being channeled through digital platforms, either through phones, the internet, and this also creates new vulnerabilities for women who would be left without access to the right and safe information at this time. So there is a question that we would ask in terms of how much can we promote the right information on menstrual hygiene at this time when women are being closed off from places that they would typically access critical information. One of the biggest challenges and risks that we have is a disruption towards products and supply chains. The economic impact of COVID-19 will force many low-income communities to prioritize other basic needs over safe menstrual products. Despite women being important economic providers, their capacity to do so is significantly affected by inequalities at the household level, more so in decision-making at the household level or even how resources will be distributed. This is a case where we've already seen that a lot of women, but a lot of households have had their incomes cut off. And so the decisions on how the limited resources will be used and distributed leaves a question on whether girls and women, especially their menstrual hygiene, would be a priority. This is of course worsened by the restrictions to movement and working conditions employed to limit the spread of coronavirus that has immediately cut off, as I said, income sources for many women in the informal sector, coupled with the pressure for women to revert to traditional care roles in the home. This has impacted a lot of women's individual purchasing power and influencing decisions at the household level that would allow them the resources to access menstrual products, but also be able to have control over their menstrual hygiene. Over 1.4 million young girls in Kenya rely on the free distribution by the government through the free sanitary pads school program. With learning institutions currently closed with the outbreak of the coronavirus, sanitary pads that were purchased for learners by the Ministry of Education were not distributed. Hence, many girls, especially those from low-income communities that rely on this distribution, have been left with limited options. This disruption of supply chains has an immense impact on the ability of girls and women to manage their menstrual cycle. Many girls are being forced to revert to non-effective homegrown solutions such as use of toilet paper, cloth, and sponge, which compromises their safety and dignity. In some towns, including an example being Migori and Kisumu, we are already seeing that girls are subject to various forms of abuse, including transactional sex by people who are taking advantage of their desperate situation in exchange for cash to purchase pads. We already know from previous work and work with our interest groups that not only do these alternatives and grown solutions affect their dignity, but also their reproductive tract infections have gone up, where cases of alternatives such as rags and cloths are often not washed properly or dried properly due to the stigma still associated with menstruation. So what we can do at this time, I will just wrap up my presentation with some of the measures to improve menstrual hygiene management. We promote and insist that any response should be gender responsive and understand the different needs of men and women. We must ensure that menstrual hygiene and menstrual health hygiene supplies are included as part of non-food items and food assistance for girls. We need to look at platforms and information sharing devices that would ensure women and girls are specifically targeted, whether it's through our messaging, whether it's through our online platforms. But we also need to look at how we can ensure that sanitary pads are deemed as essential commodities, removing barriers to manufacture and supply. We need to continue promoting each other and women's networks to make sure that that access and supply chain continues. In Kisumu, we are working with a number of women's groups who have been, we have been promoting the enterprise development on reusable sanitary pads. These are alternatives that can be accessible at the local level where we're promoting community networks as well. Private sector, we have partnerships with private sector to provide in-kind support, and this is an opportunity to continue working with private sector and partnerships that can add to the movement that is required. As mentioned before, because of how low-income communities are usually structured, there is a stigma around using shared facilities that also creates unsafe and unclean environments for especially young girls to manage their menstrual cycle. We need to make sure that as we're thinking about the preventative actions for COVID-19, we're including cleaning equipment, but also proper and regular cleaning and disinfecting of shared facilities that would also ensure safe environments for girls and women to be able to access sanitation facilities. I think I will stop there. Thank you so much for the opportunity, and I look forward to the discussion today and advancing our movement on menstrual hygiene.
Thank you so much, Farida. That is very insightful. And what caught my attention, of course, is the fact that we have over 1.4 million girls in Kenya who ideally rely on the sanitary pads school program. And now that schools are closed, I shudder to imagine what is happening in their lives. And maybe to give us experiences, I'll ask Laura Wawoda to go next and give us what are the experiences in Kilifi at the moment. I know Farida has also mentioned that in some communities, the use of facilities, it's a taboo to share, a toilet or a bathroom. I don't know what's the situation in Kilifi and what are the experiences of girls in Kilifi. Karibu, Laura. Laura, kindly unmute you. Thank you.
Thank you. I'm Laura Wabuda from Kilifi County. I work for WIMA, Women Empowerment Group. This is a registered community-based organization. And our vision is addressing social injustices so that women and children can live dignified lives. And our thematic area is on women and children, child protection, women and youth empowerment, and issues of governance. Strategies that we use: community and social mobilization, capacity building, advocacy, and network. And today I'm here to share the experiences that women are going through in Kilifi County. Yeah, no one was prepared with the pandemic, and so there's so many challenges, so many experiences that women are going through. And I'll talk mostly on the side of the girls. Girls are having challenge right now to access sanitary towels, and most of them are exchanging sex for pads, leading to increased teen pregnancy, health risk, and women are using clothes as alternatives pads. And right now we are having statistics for Uganda sub-county just for this month, for April, where we are having 77 girls who are pregnant. So we are trying to imagine if this pandemic continues or goes on, how many cases are we going to have for the teen pregnant and how many girls are going to drop out of school. So this is quite alarming. And again, in Kilifi, we are having a problem where men don't talk of menstrual hygiene or don't bother about buying the menstrual products. It is like a taboo. So it is to them, they can buy food products, they can buy other things, but when it comes to sanitary towels, they don't think of that. So to them, sanitary towels is not essential. Okay, we're having lack of access to clean water. That most of the people in the rural part of Kilifi County, we are using dam water, and it's quite a distance, so women and girls have to walk a long distance, kilometers away from home to access water. And again, this is not piped water, it is dam water, in which keeps the lives of the girls in danger. We are having just an incident that happened last month on 19th, where an 8-year-old girl had gone to fetch water in a dam, and unfortunately, she was raped and killed. So the parents had to look for her like 2 days when they found her drowning in a dam. So those are some of the experiences that women are going through. Again, we are having limited medical services in Kilifi, that most of the women are having challenge in accessing the services, and most of them also fear that they may get infection when they go to the hospital. So that is also a challenge, there's that perception. We are having rise of conflicts in marriage, incest cases are at par right now, that most of the perpetrators are at home. So our girls are in danger and the lives of women are totally in danger. Again, we are having women and girls giving birth at home due to fear of contracting coronavirus and are even losing lives. You're having cases of women losing life because a woman be trying to give birth at home, and some challenges arose when taken to the hospital, it is too late, and so she ends up losing her life. Again, lack of access to clean water has also contributed a lot in this, that we are having the issues of you must wash your hands with soap. The people living in the vulnerable families, who are coming from vulnerable families, they cannot access this water, clean water, they cannot access things like soap. So it is a challenge to them, and they are really at risk of contracting the virus. Okay, again, possibly I share what we are doing as WIMA. WIMA right now, we have been networking with other organizations and other well-wishers and mobilizing for pads, sanitary towels, which we distribute to the vulnerable families, vulnerable girls who we had marked, and also we are steering face masks and distributing to the vulnerable households. And we are also doing a lot of media education and on radio talk shows, social media, advocates on Facebook and Twitter, encouraging that people have to take care of themselves and also protect them. Thank you, Florence.
Thank you very much, Laura, for sharing the situation in Kilifi. And you've mentioned that in Ganze sub-county, 77 girls are pregnant. Yeah. And we've also talked about transsexual sex, which also Farida mentioned earlier. Yeah. Now, going to Dr. Ojiambo, I'm just wondering, in a humanitarian setup, you know, we've had floods, we have the pandemic, we have disruption of people's movement. I shudder to just imagine if this is a normal setting, let's say in Kilifi, where the issue is lack of sanitary towels. Now, when there's more disruption beyond COVID, including floods, what's happening in the humanitarian settings, and how should we respond? Karibu Daktari.
Thank you very much, Florence. I want to thank Practical Action, CREAW, and my fellow panelists, and then, of course, say Happy Menstrual Hygiene Day to all of you. Thank you very much for this opportunity to share what Rotary is doing in the district and particularly in Kenya. So as you've been told, my name is Ambassador Dr. Josephine Ojiambo. I am a physician, public health specialist, and a seasoned diplomat. I'm Rotary International's representative to UNICEF and a member of Rotary District 9212 Emergency Response to COVID. So I'd like to share the next slide. So I'll tell you a little bit about what the Rotary District 9212 is to contextualize my response on humanitarian issues. So Rotary itself is a global network of 1.2 million neighbors, friends, like-minded problem solvers, and people of action. Together, we aim to promote positive and lasting change in communities for women and girls and families, and for ourselves. And through our 35,000 clubs worldwide, we focus on providing clean water, sanitation and hygiene, maternal and child health care, sustainable peace, education, and the protection of the environment. And for the ease of administration, Kenya is situated in Rotary District 9212, as you can see on the slide. And our district governor this year is Joe Otin. Just hold that slide. And for the purpose of this specific panel, I represent the district's Emergency Response Committee for Kenya that is chaired by Dr. Joe Kamau. Now you can go to the third slide. I'll speak a little bit about our district's COVID-19 response. And suffice to say, when the government announced the first case of COVID-19 in Kenya, the Rotary District proactively put in place an emergency response. The response prioritized 4 key areas to complement the Ministry of Health action. And later, we joined the National Business Compact Coalition, where we're working with partners to augment our abilities. And so what are the 4 key areas? One is hand hygiene through the provision of hand washing stations. At the end of this month, we'll have covered 40 Kenyan counties, provided 1,800 hand washing stations, there's a picture of one, and provided 3.5 million hand washers. Our second area is personal protective equipment for frontline health workers. We're focusing on hospital-based frontline health workers at tertiary level and downwards, really in the community. And at the end of this month, we'll have provided PPE for 95 healthcare workers in hospital-type settings, at least for a month. Another intervention, the third, is Flowers of Hope. We're using the Flowers of Hope as a moment when we can encourage, appreciate, and listen to the sacrifice of frontline healthcare workers to motivate them in their daily struggle. They get up and care for COVID positive and other patients. So far, we've reached 12,750 frontline healthcare workers in 17 hospitals. And lastly, we've provided 13,358 food hampers to vulnerable families in Kenya, actually to 54,000 vulnerable Kenyans. We can go to the next slide. So you've heard from the others the challenges that we face as a country with COVID-19. I'll focus on the implications of these challenges for frontline healthcare workers in an emergency type setting. The first is that we must together raise awareness of the needs of menstrual health and hygiene for frontline healthcare workers. I just want to say in several settings, when you bring it up, there's unease, but it's across the board, not just for men, but also for women. Let's raise awareness together. Let's procure and ensure sufficient amounts of menstrual hygiene materials for these frontline healthcare workers. What am I talking about? I'm talking about access to sufficient qualities of PPE so that a woman such as this in our slide, or on our slide, can change her PPE and refresh herself every 4 hours. That's something that perhaps we don't speak enough to, but it's important. And remember, when she's fully clothed in PPE, she has to dispose of what she's wearing and then wear new gloves and perhaps dress up afresh. So they need access to PPE and access to maternal health materials. We also need to support women's continued access to contraceptives, especially the frontline healthcare workers who are women. This is so that their cycles can be regular and allow them to work freely in between the menses. But also we must be careful because in certain settings, women are being persuaded to continue on contraceptives to avert their menses. This is not right. This is actually a violation of a woman's sexual and reproductive health rights. We also need to ensure access to WASH, that's water, sanitation, and hygiene disposal systems for menstrual waste in health facilities for frontline healthcare workers. I mean, an appropriate bin in the toilet so that they can dispose of their menstrual waste. And lastly, and very important for frontline healthcare workers, provide painkillers to manage menstrual pain, allow rest and time to take a break, allow hydration for them to be in the right, if I might say, physiological status, and also when they need to decompress, give them mental health. You know that our healthcare workers are burning out. So these are the implications we have picked up in our engagement with frontline healthcare workers. Let's go to the next slide. I'd like to talk about the implications of the challenges that COVID presents to female patients. We have found that as with the frontline healthcare workers, Female patients also need wash facilities. They're in bed in hospitals, but they also need to go to a bathroom where they can have their privacy and find a bin for the disposal of menstrual waste. They also need menstrual materials. Even when they're in bed, they need to be sure they can find a sanitary pad and any other material, including painkillers. And even though we're focusing within the health sector and across the country on COVID-19, we need to ensure a comprehensive range of sexual and reproductive healthcare services for all female patients and women who walk into and access healthcare services. Let's go to the next slide. I'll now talk about the implications of COVID-19 on girls and women in communities. In the Rotary experience, we have been putting in place hand washing stations. And we have looked on in these communities, and I'm sure you've seen pictures and footage in the media, and we have seen depicted the disruption of water supplies in communities, particularly in our peri-urban slums. So as Rotary, we are advocating that we must support the continuity and the delivery of water, sanitation, and hygiene services. In fact, the sustainable delivery of these services to homes and communities. We have our own map wash system. This is an app built in a system to monitor the performance of hand washing stations. The users, are the users male or female predominantly? Are they young females or older females? Are the hand washing stations in the appropriate place? We'd like to invite you to come share with us at Rotary our experience using our map wash system. In our Rotary experience, where we deliver food hampers, we have found that it's important to include menstrual items in the food hampers, whether it's in the food or non-food hampers and items we give to communities. And this particular slide shows you one such experience. We as Rotary, working on the National Business Compact Coalition, continue to encourage paper and cloth manufacturers and industries to expand into reusable and disposable menstrual materials. This will increase the supply at household level and bring down the costs for girls and women. And then together with you in the audience, we want to call on you to help us solicit in-kind contributions from private sector manufacturers for quality disposable products for girls and women in communities. We also want to thank our government for the social assistance programs, particularly cash transfers and social pensions. What do those funds do? When they get to homes such as this one depicted on the slide, I can assure you some of that money goes into buying menstrual health and hygiene products. We also want to ask that we ensure that menstrual health and hygiene information is put out on the billboards, on the posters, wherever we have standard health services. We also want to now start thinking about alternatives to interpersonal communication on mental health and hygiene. We need to be able to have mass communication with a message on menstrual health and hygiene going out during this time of the COVID pandemic. I'm so delighted that today we're partnering with women and girls-focused organizations. This should continue to grow so that we provide frontline services for menstrual health and hygiene. And despite the COVID pandemic, we must remember that those health facilities can provide other health services. We need to be confident in that. And amongst those other services, sexual and reproductive health care. I'd like to go to the next slide. This one still talks about the implications for girls and women in communities. And I've actually covered a lot of them. So maybe we still move on and maybe go to the next slide, where I want to talk about our particular experience in Nyando. Participants, ladies and gentlemen, Rotary rolled out into Western region of Kenya to provide hand wash stations. And in the morning of the day when we were to roll out and we had the governor and other county officials ready, it began to rain. It actually rained from early morning and it was torrential rains. When we woke up in the morning, this is what we found in Nyando. We could not deploy. We had to step back a few hours and actually postpone our deployment. And during that time, we sent our members of our Rotary clubs on the ground into Nyando. And they came back with information on the communities, on their status. And in particular, the status of young girls, where girls were saying, like has been said before today, that they had to engage in things like transactional sex over a period of time in order that they could get food to bring home to the elders. And not only that, that they could themselves afford their sanitary towels, For us, this is really, really a shock. But let's go forward to the next slide. This emergency setting in Nyando awoke in us a lot of reaction. One is that, together with the National Business Compact Coalition, at one point we had provided through the Flexi Fund waste management and sanitation systems, particularly at Mbagathi, at the hospital, which is a quarantine center. The implication now for all of us is that we need to ensure the availability of waste management and sanitation systems at devolved and local levels. Another one, which has been said in a different form, is that within our tradition, really, young girls don't bathe in the same settings with their elders or with others. They're supposed to indeed use that setting on their own. So an implication would be, let's look at providing gender-separated toilets, even in emergency settings, so that the girls are not violated. This has been said more than once on this particular discussion. And perhaps even then, let's see how we can dedicate either time in the use of those facilities or form of function to COVID-positive girls and women. We're doing that in the quarantine centers. We should be able to do it in emergency settings. Also, let's provide information on menstrual health and hygiene in accessible formats to girls. Girls love their mobile handsets. Let's put information on those handsets, those of you who are tech savvy. Also, let's provide it in accessible formats to girls and women who are living with disabilities, who are differently abled, and also in local language for those who don't speak English like we're speaking today. And the basic message that the Ministry of Health and others have continued to tell us, let's ensure social distance. Let's all wear masks when we're out in public, and let's ensure that hand hygiene remains a #1 priority during this time of COVID-19, and in particular in emergency settings. Thank you so much for listening to the Rotary Experience.
Thank you so much, Dr. Ojambo. I appreciate, and thank you for giving us an insight on what happens in emergency settings. We are in an emergency setting. COVID-19 has presented to us an emergency that has disrupted everything as we know it. And what we have seen is that the cases of gender-based violence have also gone high. And because they've gone high, how do we respond? But even as I say that, how is GBV linked to menstrual hygiene? Well, the expert is here, Angelina Shikanda from CREAW, who will tell us how these two issues are interlinked. And I'd just like to tell all our participants that please, you can write your questions on the chat and the panelists will respond. We'll have time for question and answers and respond to your questions. Angelina, please continue.
Okay. Thank you so much, Florence, for that, and thank you all the panelists. This is very enriching. As you've heard, my name is Angelina Sikanda. I work for Center for Rights, Education and Awareness. This is a women's rights feminist organization. We've been around for the last 20 years, and we're happy to share experiences, especially right now with the COVID pandemic, and especially around menstrual hygiene. Next slide. For us as an institution, we focus on 4 thematic areas. We have got violence against women and girls. We focus on issues of women leadership. We also focus on sexual and reproductive health rights, as well as economic exclusion of women in the development sector. Specific to this discussion of today, we'll try and focus our discussion on GBV, and especially on issues affecting our girls at this particular time. As our moderator has rightly put, we are seeing a lot of cases on gender-based violence. Our recent reports, which you can check, the judiciary has come out to speak loudly and clear that they're having a lot of cases of sexual exploitation of our girls, and especially women. Our own Chief Justice has noted 35.8% increment in cases of sexual offenses. The Ministry of Gender has also noted an increment in cases reported to them and into their offices. As an institution, we've noted an increase of about 53% of cases, and the numbers continue to rise. The National Hotline for GBV has also reported an increment of cases at 75%, and the numbers are soaring at a very increasing rate. So it is an issue of concern. We've had it in the public sector, and so it's about time that we do something about it. Next slide, please. So what are the issues? And so the issues that we're seeing most prominently are issues around sexual violence. We're having people living together with their perpetrators. People are in conflicting relationship, but because of COVID and the curfew rules, you're living in a household and you're asking yourself, what do we do? People are not contracting well on sexual issues, and so sexual violence is the highest issue that is on our radar, 39%. Domestic violence is also on the rise because at the time when the curfew came, not everybody was also within their own, what we'd say, comfort area. And so it's a new norm, living with your spouse, spending more time than normal that you're used to. And so how do you improve on the relationship and realize that communities are challenged in being able to identify healthy relationships? And so issues of violence are there. We're seeing economic abuse at 14%, and which is especially targeting issues around menstrual hygiene, and as well as emotional abuse. There are also incidences of femicide with a few cases of murder where people in relationship or intimate relationship, and those are resorting to killing one another. But the statistics are still showing us that more women are dying than men, and hence femicide. Next slide, please. So what are the issues related to menstrual hygiene or gender-based violence as we report that the incidences are high? One of the biggest aspects is around economic stress. Women are trying their level best to manage. As you know, menstrual cycle is unpredictable for majority of women. So you cannot tell when your menses will come. Some people have regular menses, some don't have regular menses. And so in the current economic stress where some people are being laid off, others are on half pay, others are not sure what tomorrow will look like, they cannot go and earn their living, then the stress of not having these funds means that issues like menstrual hygiene have been looked at as a luxury. So you don't have money, what do you do? Hence what the other panelists have talked about, people resorting to unhygienic materials because there's no way a woman can stop her menses. You can't say it won't come today. You cannot predict. And so the restricted access, if it comes at night and it's curfew, what do you do? The schools are closed, which is an avenue for most of our girls to access the sanitary towels in the rural areas. So what are they using at this particular point in time? So some are self-isolating as well. They're locking themselves up in a room or sometimes in a space where they feel safe for the duration of the menses. And this is very risky to our women and girls. We've seen cases of women being beaten as they're trying to access a shop because the police officer is saying you're supposed to be at home. They're not considering the fact that this woman has to rush to a shop to access an essential commodity. Next slide, please. We are also seeing a lot of attitudes where people don't understand the biology of menstrual hygiene, then are able to look at women and say, you people are just being ridiculous, why you should understand it's a pandemic. What they fail to understand is that menses do not care about a pandemic. They will come as they will come. And every woman's experience is different. And so the shaming when a girl has soiled her clothes, the shaming when a woman is trying to access even basic pills, painkillers, it is a critical issue. And the result of this reaction, then we're seeing a lot of violence. We're also seeing a lack of critical information being shared. If a girl out here is at home and now she's reached menarche here, who's next to her to give her the critical information about what to do? Well, that information may have been shared probably in school. This is a critical time when a girl needs to really know how to maintain her menstrual hygiene. Who's next to her? Is it her auntie? Is it her mother? Is it her sister? Do they have the right information to give to her? Are they able to support her? The products we have in the market, they don't fit everybody. That is a reality. Not everybody is comfortable with the available products of the pads. Not everybody is comfortable with the tampons. Not everyone can access and afford it. So what else is there for women to use? what are some of the things that we need to do as an institution, and we need to ask our government to support us to be able to have as a country. We keep saying that it should be as obvious as the way you go to a shop and find condoms being distributed freely. Every girl and woman should be able to access a sanitary pad wherever they go. And so those are some of the things that you're looking at being things that you need to do. We also need, you know, the other supportive items. So I know my other panelists have talked about that. And so it is important that as you give essential services, then look at what this means in regard to menstrual hygiene for women and girls. Next slide, please. And so what are we saying? How do we wish to move forward with this? So as an institution, we are in touch with shelter facilities within the country, in different parts of the country, in the counties as well. And so one of the things you're saying is, if you feel unsafe, if violence is being meted on any woman or girl, kindly reach out. We do have shelters and safe houses for their temporary support, so that we are able to look at the issues and be able to identify the perpetrators, and so that action is taken. Regardless of the curfew, it is no reason to commit violence on anybody, and if there are any cases, then we need to make sure that the women are supported. If they go to a shelter facility, then we are asking the shelter facilities to make sure that they have dignity kits for the women and girls in those spaces, that it's not just a space for someone to sit and say, I'm away from the perpetrator, but a space where you are able to access the menstrual hygiene items that you require on a monthly basis. So that is being done. We are also talking to medical practitioners to make sure that medical care is provided as and when required to our girls and women, and that it's, you know, there's no sorts of interruption, because we had an incident where practitioners were saying it's because of COVID and therefore they're not providing social services. We are also having psychosocial and online counseling going on ourselves as an institution. Our hotline is operating at the moment. I'll give the number in the next slide, where you can be able to access information around how to address issues of GBV. You'll have access to a legal practitioner as well as a counselor. These are services that are available from our offices. And we also want asking the public to make sure that our girls are able to participate in daily activities. Simply because a girl is on her menses doesn't mean you deny her an opportunity to continue with her online classes or activities in the household. Kindly allow them to do so, because having our menses is not a sickness per se. It does sometimes occur where you're unwell, but it doesn't mean you're handicapped because of the menses. It means you're just having a phase where you need additional support, but you can function as normal as possible, depending on how much the strength the person has at that particular moment. Next slide, please. You're also asking that as we do our information sharing and we do the targeted messaging, then include information around menstrual hygiene. Don't just give the food. Don't just give the pads. Please make sure you also add the, the painkillers. You also consider that not everybody can use a tampon. Look at the other products in the market that could be used. For those who are doing cash transfer, consider that the package you're giving and the amounts of money being distributed takes into account the needs of the menstrual needs of the women and girls. So don't just count the food and the soap, also count the parts that are required, and this on a monthly basis. So we also need to make sure that the cash is able to be accessible by the women and girls, and so that they can be able to purchase the products. We are also working with the other stakeholders and reaching out to government to be able to demand that as they respond, and at this particular time, the cases of violence reported are also prioritized, so that the police will react and rescue anybody in crisis, whether it is a man or whether it is a woman, and that we have information and data is captured in terms of what are the experiences of our women and girls out here, where are the areas that we're not reaching out to, so that actors can be able to come in and be able to support those in crisis. Next slide, please. And so we're also asking the private sector to also go ahead with the inventions that they do, because you're saying, are we saying that these are the only products that women and girls can use in the market? If someone is reacting to the pads, the quality issues that we need to look at, is this it? So we are asking even creatives to help us in terms of coming up with alternative materials that will be able to be hygienic, the appropriate, the absorbent, and actually recognize the needs of women and girls at this particular point. Because right now we only have, we know that women and girls are using clothes out there, those who can't afford. So what else can we use to every month for women and girls? And even one that we can be able to do locally. That is something that we're also open to ideas. And so all the actors are asked to chip in and do something about it. We are also looking at the products we have already. What is it that you can do to make them more affordable? At the moment, a pad would go for about 80 to 100 shillings. Not every girl or woman can afford that. How do you make them even more cheaper? So they are called to actions. We have called to the government to make sure we zero rate and properly zero rate sanitary towels so that they are easily available to women and girls. We do know that our women members of parliament have funds like the affirmative action funds. Every other institution has some money. Can you prioritize menstrual hygiene as part of the essential items? So those are some of the things that we are calling to action on all of us as practitioners, as individuals, as well-wishers who are willing to get out there and support our women and girls. Consider menstrual hygiene as a critical factor. Make sure that every woman and girl feels supported wherever they are. COVID is here, and as we've critically learned, it's not permanent, it will end. So what we're saying, let it not end with bad experiences of women and girls. Let us journey together and support one another, and that moving forward, lessons learned through the COVID pandemic will help us respond better, support one another better, and that our men and women can be able to support one another, especially during menstrual times of the month. Thank you very much.
Thank you very much. I'm receiving lots of texts, lots of chats congratulating you ladies for this particular discussion. I think Dr. Jambo, your friend, is watching. She's called Patricia, and she said, thank you very much. So thank you, ladies, and I'm happy that it's us ladies discussing what is affecting us anyway. So a quick question. I just want to go to the questions that that have come up from our attendees. Please continue writing your questions. We have 18 minutes, and I'll field the questions, and any of the panelists can respond to these questions. We have somebody asking, please share the slides so that we can study later and better understand the plan for actions. I think we'll make it available from the websites of these organizations that you see here. But I also know our technical people have told us they'll be available on Facebook as well. So please stay with us. Then somebody talked about, I think it's you, Farida, who mentioned something about reusable sanitary towels. How are we able to check the standards and quality of reusable sanitary towels? Farida?
Thanks, Lawrence, and thank you, anonymous attendee, for the question. It's a really important one because we know that majority of the products in the market are the non-reusable ones. And currently, actually, the Kenya Bureau of Standards do have draft guidelines for the reusable pads. These are commonly, the common raw material is still cloth. But what the KEBS is trying to do is develop draft guidelines and standards for reusable pads. And we are working with, I specifically talked about the community women's groups that we are working with in the Lake Basin region to promote reusable pads. And we do have to work with public health officials to ensure compliance towards these guidelines. And so promoting the reusable pads, for example, is one way of encouraging also local supply. We know that, as I said in my presentation, one of the challenges that would be compounded by COVID is free access to products and the comfort of purchasing products. So promoting the reusable The reusable pads might look like an increase in cost, but of course will ensure better access to products and pads for women in rural or low-income communities.
Thank you, Farida. Somebody has also asked, somebody is watching us from Mozambique. So they say first, she's called Helena. I don't know if she's your relative, Angelina, because I think we are all Bantus in this sub-Saharan region. So she has your surname. She says, first, thank you. I'm connecting from Mozambique. As I left, I felt that this webinar is relevant to the situation in my country, Mozambique. I recently visited a maternity in one of our provincial hospitals, and the conditions were just depressing. Mothers have been moved, practically jumbled into one room, with most sharing beds and left with poor sanitary conditions. Basic hygiene such as washing hands with water and soap was not even available, let alone someone to ensure that the ladies as well as the visitors were following hygiene measures in this COVID period. What struck me most was that no one was demanding that better care was provided for women. What can we do, or what are you doing in Kenya to demand that health facilities, sorry guys, I'm trying to scroll down. Health facilities are not only providing additional hygiene measures for their patients, but also ensuring visitors are not risking the lives of mothers and newborn babies. I think I'll give questions to Dr. Ojiambo of proper sanitation, proper hygiene measures within hospitals. That will be useful for mothers as well. As you rightly put it, frontline workers also lack these basic facilities. So please enlighten us as we enlighten this lady from Mozambique.
Thank you very much. I want to thank Helena from Mozambique for her question. And I'll first make reference to a visit that we paid last week as Rotary Clubs in Kenya and Rotary Club of a place called Thika Road. We went to Kenyatta University Hospital. This is a hospital built just outside of Nairobi on the way to Thika. And we heard not only the particular experience of frontline healthcare workers, but the chair of the hospital, Professor Mugenda, told us about one of their patients, a COVID-positive mother who had just given birth and had a bouncing baby boy and was doing well. Of course, all of us were taken aback because you almost think that in a hospital that is a major quarantine center for the management of COVID, that you wouldn't be hearing about maternity. Yet within that setting, these health workers were able to ensure the safe delivery of a mother. We need to document best practice such as this and replicate it, share it and replicate it. Because COVID, by the way, is going to be the new norm. The virus isn't just going to go away. It's going to be with us, perhaps at levels where we're learning to manage and live with it. And eventually, we're going to have to then focus our health sector on providing the services that it should provide and that it was providing in the past to take care of other communicable diseases, to take care of non-communicable diseases, and also to take care of the emerging mental health. However, let me go back. Inside all of those interventions, there must be care for the sexual and reproductive health of women. So I want to say, putting in place a hand washing station is not a very expensive intervention. At the most we have been able to deploy over a month a hand wash station at less than 7,000 shillings in every setting. And yet it provides many, many hand washes. That is a very easy intervention. And as I've said, dedicating bathroom and toilet space to women and girls, and then giving dedication in time and function to COVID positive patients is possible. So we need to now reinvest in not only our public healthcare system, but also in the hospital system and in our frontline healthcare workers, as COVID is really going to be the new norm. Thank you.
Thank you very much, Dr. I appreciate I'm glad you're saying this is the new norm, because the new norm tells us our health facilities need to be better. We need to plan better. Never before have we seen, I remember when I was growing up, there was a discussion about, or there was a campaign about Imagine You High. And for this season, we have seen Kweli Imagine You High, that if we don't have access to water, it also limits our menstrual hygiene, limits how we can stop the spread of the virus. Somebody, Judy Museve, is asking, and this question I think I'll give to Angelina. As we enhance menstrual hygiene, in controls, can we also have a sensitization to men?
Yes, COVID hygiene, yes, is we need to sensitize our men. You need to understand the biology of menses, because whoever is nearest to a girl in need of sanitary towels can purchase this for her. A girl doesn't have to be made to feel shy to ask a father, an uncle, a brother, buy me these pads. It should be as automatic as the way you ask, give me bread and tea every morning. So yes, we are educating our men and women that it's time to stop the period shaming and embrace it as part of our everyday lifestyle. I've also seen a question around the shelters. Why are we taking men to shelters at this particular time? Sometimes when the violence is too much, it's necessary to separate people in intimate relationships or those people who are having conflicts. So shelters are available to be able to provide temporary support so that people are able to recollect themselves and then be able to think critically how to resolve the conflict and then go back to their normal way of life. So those are opportunities that we have. And also we can put a slide up to show the hotline. We do have a hotline for GBV cases. The number is 0800-720-186. This is a GBV hotline by CREAW, and also people can also plug into the national GBV hotline 1195 to report any incidences of violence. What you're saying is don't go through violence alone, speak out, seek support, let us try and save lives in the midst of the pandemic. Let's not, yes, thank you very much. So that is a hotline for CREAW. If anybody feels they need help, love isn't abuse, that is our slogan, saying that we need to stop the violation. Let's look for healthy relationships and let us support one another at this particular time. So thank you.
Thank you. Let the slide remain, even as we answer the questions. Somebody is saying, I'm interested to understand ways in which we can continue to hold our government accountable during this unusual time on sexual, reproductive, and health rights services, when we can, to some extent, understand their prioritization of some services and not others. I think, Farida, do you want to take that? You can just note it down. I'm seeing we are coming to almost the end, so I want to capture as many questions as you can. Our participants, thank you for joining us. I know we might not be able to answer all questions, but we will try and answer as many as we can. Farida, pick that question on how do we hold our government accountable, especially in this time, so that they prioritize sexual, reproductive, and health rights in relation to menstrual hygiene. There's another question on it's appalling women resort to transsexual sex to fund basic needs and Bipods. How are we leveraging on reusable, easy to make at home pads? I think that question was answered by Farida earlier, discussing with the Kenya Bureau of Standards in making sure that we have good quality standards so that these reusable pads are much cheaper. We've seen with the masks that people are resorting to reusable masks because then you can't afford to buy the other masks that you can dispose every day. Laura, somebody saying Kilifi experiences are very common. Is there a simple way of making sanitary towels at the counties? I think all our questions are coming in looking at what are the solutions to provide sanitary towels. Are there any efforts being made to address sexual education to our schoolgirls, especially now that they are not physically attending schools, and especially because most parents in the rural setup expect this to be a teacher's role? Who wants to pick this one? Are there any ways to address sexual education to our girls, even as they are at home.
I can do that quickly,
Thank you.
Florence.
Thank you. All right.
If part of the, if you call a hotline, you get access to a counselor. And so one of the things that we is being able to talk to our girls, so that, and it's toll free, so you don't need to have money on your phone. If you call them, call back and make sure they speak to you. And if there are any champions in the area that you're able to link or institutions, then you link these girls, people can be able to support them. Is to be able to have the education they need and information necessary so that they maintain their hygiene at all times. Yeah.
Thank you. Farida, there was the question of holding governments accountable.
Yeah, thank you. Very quickly, I think this is, I also saw another question on tax on towels, so I will respond.
Yeah, I wanted us to end with that one. Just do the one on holding governments accountable. I want us to each have a take on that one, but please answer the one on governments accountability. Thank you.
One of the things that, of course, the Kenyan government did almost a decade ago was to remove import duty and VAT on menstrual hygiene products and solutions, but the implementation is something that we need to continue with. The government as well, allocates millions of shillings towards the National Sanitary Towel Program, since 2015, which has focused on distribution of sanitary pads to primary schools across 82 districts. And of course, as I mentioned before, the menstrual hygiene management guidelines that the Ministry of Health has been working on, that still leaves us with some gaps. I think I mentioned before that even with the current provision of sanitary pads to primary school children, we still have about 3 million girls in primary and secondary school who are left out of the program. So part of what we can do is look at how we can advocate for an extension of the supply, but also there are other aspects that we need to work on, whether it's about knowledge that we have discussed here. When we look at the management guidelines, there's been frequent turnover in government, and we need to continue our advocacy and engagement and coordinating with other leaders to make sure that MHM is a priority. This has been quite a challenge when we look at the guidelines taking a long time to be finalized. Even with the free sanitation towel program, for example, has met criticisms. One of the things that we can do to work with the government and support them is on evaluations and impact. This has been a role of civil society that we cannot let go of. How are we making sure that the right girls are being targeted as part of the program, but we're also able to support the government with evaluation and impact of the program. So there's still a lot to be done in terms of advocacy, awareness, inclusion, changing community norms around menstruation and menstrual health. We know that some of the issues around price and access would also be helped if we were looking at it from a national perspective and not really, breaking down some of those social norms around that this is a female issue. And so, for example, mothers are responsible for passing on the knowledge of menstrual hygiene to girls, where some of the work and some of the communities that we've engaged with, actually 2 out of 3 young girls rely on men or their sexual partners to provide and receive access to their pads. So we do have some social elements as well, but we also still have a massive role as civil society to support the government and work with the government to ensure that menstrual health management is a priority at local level, but also at national level.
Thank you, Farida. I am pressed for time, and I wanted this particular question, maybe just to you, Farida, first of all, to just tell you that there's somebody who's watching us, Dr. Selina, who's mentioning that hygienic disposal of used napkin is a in a densely populated country like Bangladesh, especially in the slums. We are working here with practical action in Bangladesh, and it's a huge challenge. Please suggest or focus on the issue of disposal. So this is something to think about, even as we answer the last question, which I want us to close this webinar with. Can the government come up with a way of making sanitary pads free of charge? And then the person asks, why not? Why are condoms free and yet pads are charged, and in fact, and charged? This could cushion the girls even at this time of the pandemic. And I also saw another comment that we should not be charging a natural thing that occurs to women. Therefore, we should have provision of sanitary towels by government to everybody. So there's no inequality in access. What's your take, Dr. Jambo? And then we'll go with Laura, and then Farida, and finish with Angelina as we close. Dr. 1 minute or half a minute in responding to that question.
Okay, this is a favorite topic. But you know, the thing is, we need to continue the advocacy on zero rating the inputs into manufacturing menstrual hygiene materials. And when we do that, we bring down the cost. But the thing is, we must also ensure quality. Because at one point when we actually had an effort towards zero rating, you will recall in the media, we read stories about menstrual hygiene products that were causing allergic symptomatology to girls. So there's a balance. You must bring down costs, but ensure quality. But I think we also, on the macro level, need to keep engaging the Ministry of Health and other players. And there's an opening. We do have within the second tier of leadership of the National Emergency Response to COVID, an engagement called the National Business Compact Coalition. It's not just about private sector. We have NGOs on it, such as Practical Action. Give them messaging, because when they come to the table, we engage with the Ministry of Health at that forum. And this is where you can put their feet on the fire, keep their feet to the fire, and keep them engaged. And then another thing is, let's have proper formative research. It's one thing to say, oh, women are affected and the rest. Come with figures and tell us how this particular issue is affecting the economy. How many days of work lost? How many illnesses could be abated? What would that be on the health sector in terms of release of money and time of healthcare workers? And then a very quick one as I end my 1 minute. Continue the communication. I want to add to Farida. Young girls and women now across the country have a mobile handset. When did we see a message on menstrual hygiene on a mobile handset? How come we see everything else? Let's begin to innovate on messaging where people collect their daily information. And we have players amongst us, Shujaz, which is in the community, and young people listen to. We also have an opening to use the mobile doctor apps. I hear Safaricom has one. If you can dial in and get health information on any other condition, you should be able to dial in and get information on your menstrual health on the same platform. Thank you so much, Florence.
Thank you, Dr. Laura, 1 minute. Condoms are free and sanitary towels are not. Laura, your comment? Is she with us, or she's having poor connection? I'll take it to Farida then, and then we finish with Angelina.
Thanks, Lauren. I think Laura was on mute.
Okay, Laura, please go ahead.
Thank you, Farida. Okay, condoms are luxury, and I feel pads are essential needs, and so I think the cost of the pads should be reduced. And again, you are having people like Kenya Works who have been distributing a lot reusable pads. So I think as a people that we can engage and we see how they're doing it and how we can reach out to the community. Yeah, thank you.
Thank you, Laura. Farida, condoms are free, pads are expensive. What's your comment?
I think my suggestion would be let's take today as a mark in a movement that we need to continue to push for. You know, there hasn't even a really strong national campaign around menstrual hygiene, or just the need for pads and menstrual products to be a right and to be seen as a necessity. And at this time, when we're talking about COVID and the limitations that are just coming about, it's the time for us to continue that. So as Ambassador Dr. Josephine said, you know, let's make it a priority in everything that we're saying. Let's put it at the forefront in our messaging. Let's build our partnerships around this. Today, our team in Kisumu is actually doing a free distribution with Cotex Kenya. So let's not forget the same private sector who are there and are willing to partner with us. But it needs a stronger movement, and we need to break down the stigma that is around menstrual hygiene and the rights of young girls, especially, and women, just like all of us on this call.
Thank you. Angelina?
Yeah, totally agree. All I'll say is join us, as many of us, the more the voices, the easier it is for our leaders to listen and for our actors to take action. And yes, in our dream world, in a world to come soon enough, pads should be free. And so please join us, join the campaign, join the stakeholders, put your voice, let the women speak, let the men speak. And yes, we can reach there and have the pads being free. And we can also help our researchers to be able to produce them locally, to be cheaper and more accessible to everyone.
Very well said. Thank you so much, ladies. Dr. Jambo, thank you for your time. Laura Wawoda, thank you so much, all the way from Kilifi. Farida Aliwa from Practical Action International, thank you so much. Angelina Shikanda from CREAW, and all the organizations that came together to make this possible. You are getting also supporters on the chat. Pads should be free. I think there's a campaign that has already started. You have infused something in our participants that we should have pads for free. I personally advocate for that. Condoms are a luxury item. Pads are a necessity. So happy Menstrual Hygiene Day, ladies, and happy Menstrual Hygiene Day for all our participants. I think we had about 61 participants, so thank you so much, and God bless you.
Thank you.
Thank you.
Thank you.